Hello everyone, I am Dr. Raghav Malik, Consultant, Cataract and Refractive Surgical Sciences at Center for Sight. Today we'll discuss with you what exactly is a Contoura LASIK procedure and what is an EPI Contoura LASIK procedure. So a lot of my patients ask me that doctor, what is an EPI Contoura and what is a Contoura? Despite both the terms having the word Contoura in it, so what is it different from each other? How are these two words different? So let me clarify this for you. So in a Contoura LASIK procedure, this is a flap based procedure that basically on the cornea we are making a flap, and the EPI Contoura is a flap less procedure. So let's discuss looking at how the structure of the eye is. So if you see that this is the cornea or the outermost layer, or we also call this the काली पुतली या फिर आंख का सबसे बाहर वाला layer. So the cornea is divided into 5 to 6 layers, and the topmost layer is called the epithelium layer. Epithelium. Right? This is like the skin. Like our body is covered by skin, similarly our cornea is also covered by a skin-like layer known as the epithelium. This is the epithelium layer. So in a Contoura LASIK procedure, we use a femtosecond laser and we make a flap on the cornea. How do we make a flap? We fire a laser and the laser goes into the cornea and we make a flap. This is the flap, and this flap is then raised. It is then picked up, and then one more type of laser, which is the Contoura laser, is fired onto the cornea. Let's discuss what is so special about this Contoura laser. So the Contoura laser is also an excimer laser. Excimer का मतलब excited laser. That is, once this laser falls onto the cornea, certain amount of excitation happens in the corneal cells, and then this burns tissue. So similarly, the Contoura laser, what this is doing is that it is what we do before the surgery. We scan the cornea or we scan your eye. And like we have a digital fingerprint, similarly we take the eye print of your eye and it maps about 22,000 specific points. And these points are then stored into a machine, which then goes into the laser machine, and the laser fires according to your exact eye map. So it is a very customized and a very specific type of laser. So this laser then falls on your cornea and certain amount of tissue is then removed. Once this tissue is removed, your power also disappears, and any irregularities that your eye may have. So imagine that if this is your top layer, this is what you see, there are certain amount of irregularities, which are very micro irregularities, which is not visible to the naked eye, but we can see with the specific type of machine that comes with the Contoura. And these irregularities are measured. So when this laser, the excimer laser, falls on the eye, it actually just smoothens it out. So these irregularities disappear and your cornea becomes very smooth. That's why the vision that you get is actually better than supervision. That is, you get better than 6x6 vision. Such patients are very happy. But so the Contoura laser also has a set of side effects. So because it is a flap based procedure, like I said, a flap is made. If you have a trauma, let's say a child was to hit your eye, or you fall down, or you get into a fight and someone hits your eye, the flap can always get dislodged. ये flap जो है अपनी जगह से हिल सकता है, and that is why there is always a potential risk of the flap getting dislodged. So any laser based LASIK procedure, may it be eye LASIK, may it be femto LASIK, may it be Contoura LASIK, may it be wavelight LASIK, may it be any LASIK always has a chance that the flap can actually move. So that is why lenticule based procedures came, and they gained more popularity since there was no flap. And also flap also has certain types of complications. अगर ये आपकी आई है एंड आई का फ्रंट व्यू है और ये मान लो आपकी आंख में फ्लैप बना हुआ है, so the flap can actually have very small distortions known as flap striae, and these can actually cause distorted vision at night. When you are driving, you can feel that the light is actually distorted or it is expanding. You can have halos, you can have glare. Patients can complain कि रात में drive करना impossible हो गया है. That is why flap-based procedures have slowly been reduced, and the world is now shifting to lenticule-based procedures. So this was the complication that people were feeling with these flap-based procedures. So now let's discuss what is EPI Contoura. So EPI, I told you what EPI is. So like I said, that if this is the cornea, then the outermost layer is known as the epithelium. If the thickness of the cornea is about 520 microns, the thickness of this topmost layer is only 50 to 60. Like when you get hurt, when you fall down, you have a scratch on your skin, the skin can grow back. Similarly, if there is a scratch on the epithelium, it can always grow back. That is the beauty of the cornea. So in this procedure, in the EPI Contoura procedure, this is also a touchless, bladeless procedure, all laser procedure. What happens is there is another type of laser which is also an excimer laser that will first burn away this epithelium. This epithelium is burned away. So we will fire one laser and we will burn this entire thickness of tissue, about 50-60 microns. This is burnt away. Once this is burnt away, we have access to the next layer, that is the stroma or the centermost part of the cornea. And then जो लेजर हमने Contoura LASIK में फायर किया था, जो आपके 22,000 पॉइंट्स को मैप करके आपकी आंख के हिसाब से लेजर फायर करता है, वो ही लेजर अब हम इस लेयर पे फायर करते हैं. We fire the laser here and some amount of thickness is removed exactly like how we remove in the Contoura LASIK procedure. फर्क क्या हुआ? Contoura में हमने लेजर से एक फ्लैप बनाया था जिसको हम उठा देते हैं, और EPI Contoura में हम कोई फ्लैप नहीं बना रहे, हम ऊपर के जो थिकनेस, जो एपिथेलियल लेयर है, इसको हम बर्न कर रहे हैं. इसको बर्न करके एक और लेजर फायर करके नंबर को हटाते हैं. अब obviously आपके माइंड में क्वेश्चन आएगा, you will definitely question that once the top layer is removed, how can you leave it like that? So we don't leave the eye like this. What we do is, once the top layer or the skin layer has been removed and the second layer also fires and takes out your power, we put a contact lens on top of your eye. So we put this lens on top of the eye and we let the topmost layer or the epithelium layer heal. The healing takes about 4 to 5 days. So in the Contoura LASIK procedure, the very next day you get 6x6 or better vision and you can start all your activities. You can start your computers, you can start going to office. It's one day surgery and the next day you can go back to work. But in the EPI Contoura procedure, since the topmost layer has been removed, this takes about 4 to 5 days to heal. That is why in the first 5 to 6 days, once this layer is healing, you might feel there is some pain, there is some irritation, there is watering. So there is no immediate visual recovery as compared to Contoura LASIK, where you get immediate vision. In EPI Contoura, you will not have immediate vision recovery. Vision recovery takes about 2 to 3 weeks. Why? Because once the skin layer has been removed, it takes about 4 to 5 days to form. But this layer is also still weak. It takes about 2 weeks for this to solidify and become as strong as it was prior to surgery. That is why vision recovery takes a little more time than it takes in Contoura LASIK. But the advantage that this procedure has, there are lots of jobs that require someone to not wear glasses. They can be in the forces, they can be in multiple government jobs where LASIK is not allowed. And once you do a Contoura LASIK or any other procedure, you can always see, a doctor can always make out that the surgery has been done. But in the EPI Contoura procedure, ऐसा कोई भी scar या कोई भी आंख में mark नहीं रहता. So the patient can actually have a LASIK procedure done and no one can actually find out that there is a scar or there is any mark. So in a Contoura LASIK, you can see, जो मैंने आपको बताया था कि हमारी आई के अंदर ये flap है, ये दिखता है Contoura में. EPI Contoura में ऐसा कुछ नजर नहीं आता. So the eye is absolutely clean. Even though it takes about 3 weeks of visual recovery, but the eye becomes very clean. It is a very old and very time-tested surgical procedure. EPI Contoura has been there for the past multiple years. It has withstood the test of time It may give you vision recovery slowly, but it is a sure and safe procedure. It takes time, but it is very, very safe. So yes, your doctor may suggest one type of surgery to you. It could be EPI Contoura, it can be Contoura. In all possibility, you are fit for both. EPI Contoura has its limitations, that in Contoura LASIK or a Contoura LASIK procedure, we can do a surgery up to -8 to -10. In EPI Contoura, we prefer not to go more than -5, -6, because if we go more than that, there can be a particular type of complication, that is हमारी आंख की काली पुतली में सफेदी आ सकती है, जिसे हम corneal haze या corneal scarring कहते हैं. So we prefer not to go more than -6 in EPI Contoura, while in Contoura LASIK we can go up to -8 and -10 also. So you may be fit for both, or you may be fit for one. You are not the right person to decide. Let your ophthalmologist see your examination, see your tests, and discuss with you what exactly is the right type of procedure for you, so he or she can help you decide.
Follow Planet LASIK and post your queries to get answers from the experts.